Your first vote, Mr. Guinta, was to repeal the Affordable Care Act, which would vastly expand health coverage to the middle class and to children. Then later on, you voted for the Ryan budget, which would end Medicare as a guaranteed benefit for people like myself and would substitute it with a voucher, and would also gravely impair the Medicaid program, which is a safety net for working people, lower income people, and the poor. So I want to know how you can square your sympathy and the kind words you say about people who need jobs and people who are falling through the cracks with your record. It is astounding to me that you would want to take a successful program like Medicare and Medicaid and eviscerate them at a time like this. It is a fact that these programs can be improved, they can be targeted, there's plenty of areas where they can be more cost efficient, but no, you went and voted for a terrible agenda for those of us who need health care. And not only that, you went along with your party and you endangered those of us who are retired and are living on our 401ks. Every one of us, everyone I have talked to is really anxious now because of the brinksmanship that your leadership and that you and your vote brought to the country and to the whole economy. So how do you square those votes? I don't want to hear about your influence and how you're going to bring the office for these things to happen. I want to know about your votes and your policies, and I'm not happy at all.
I want to answer her question.
I was going to make one point on your behalf. My name's Steve Durgan. I'm from Portsmouth. I first want to say I'm not very happy about the Congressman's vote on raising the debt ceiling, but I think she's misunderstanding some of the things that he's doing. By doing that, he was giving
answer.
Okay, I'm sorry. I just wanted to get I'm sorry about that.
No, that's okay.
Okay.
You know, it's an important thing for us to have these meetings and these dialogues, so we can voice our opinions, we can talk about what has transpired, and you know, it's pretty clear that you and I have a difference of opinion about these pieces of legislation about public policy. That's okay. And I'm glad that you're here, and I'm glad that you're voicing, you know, your frustration. I don't support the President's health care bill. I personally don't, and I don't think that it does what he intended to do. What he wanted to do when he first started this debate was increase access to health care, and he wanted to lower cost. I don't personally believe that this bill achieves those two objectives. Now, we can have a fundamental disagreement on that. I agree with you that health care and cost needs to be changed and improved in our country, but I hope that we can respect the fact that we have different ways of approaching that solution. I personally believe that, you know, the community health-based system.
The community health centers are greatly enhanced under the Affordable Care Act. So that is a total diversion. That's not what the facts are.
Well,
it's not a matter of us having different opinions. It's a matter of respecting the facts and what is going on in this country. And I feel that you are either confused or you are misleading your constituents, Mr. Guinta, because that is not the case.
Okay.
The Affordable Care Act has not been fully implemented. The Congressional Budget Office has estimated that 31 million people will have an enhanced access, and the lower income people will have subsidies to pay for it. So I don't know what you're talking about, a different approach. The Republican plan said it would cover 3 million people. That's useless.
Well, let me try to finish answering your question.
I will let you, and I appreciate your letting me speak.
Sure. No, it's my pleasure to have you here and to give your opinion. We have a different approach to how to solve the access challenge and the cost challenge. Now, I respect the fact that the President brought an idea forward, but I disagree with the idea. I disagree with it respectfully. I talked about this quite a bit over the course of my campaign. I made no secret of the fact that I voted to repeal the bill. That doesn't mean that I don't look at alternatives or other alternative solutions to reduce the cost and increase access. And I want to tell a little story about the perspective that I have that I brought to Washington when I was mayor. As a mayor, the state's largest city, 110,000 people, we had a line item in our budget. We were self-insured about $15 million just for the employees. That went up, just like most employers, as well as most individuals, anywhere from 12 to 15 to 20 to 22% annually. That is a problem. So if you're an entity and you have shrinking revenues, as we have over the years, you've got to come up with solutions to try to figure out how to achieve the objective, which is providing that care and that access. So there's a couple of things that we did in Manchester that I think should and can work in the state and maybe even in the country. First thing we did is not legislate, but make on a voluntary basis. Any employee, we provided them with the cost of different procedures within the network. One of the problems that I think we have in the healthcare business is that we don't know what the cost of individual procedures and surgeries are. Now, when we go purchase a good or a service in any other industry, we know what the cost is, and we get to shop and we get to compare. So, on a city level, we provided that information to individuals. We didn't mandate it by legislative process. We just made it voluntary. It said, if you choose the lesser of, say, 3 choices, we will share with the employee in the savings. In the first week, it saved $40,000. And my goal was over a calendar year, a fiscal year, to save $500,000. $500,000 is about 1/3% on the tax rate in the city of Manchester. It didn't change benefits. It didn't change access. It didn't limit benefits or limit access. What it did was give individuals the freedom and the opportunity to make a decision. And I have to tell you, we have 17 unions in the city. The unions loved it. They actually worked with me and the Board of Aldermen to implement this, because it was, quote, management and the employees and their representatives working together on trying to find a common solution. And it has been a success. It's not just that one thing that has made the reduction of health insurance less expensive for the city, but there are other things that we've got to do. I personally believe that we've got to bring more carriers back into the state. We have roughly 3. So, how do you do that? Well, we have 1.3 million people in the state. And from a business perspective, these carriers say, well, that's a small group, so why don't we erase the geographic lines between us and Maine and Vermont and Massachusetts and either create a regional opportunity, whether it's New England or the Northeast, create greater opportunities for more carriers to be providing options. And that, like it does in other industries, I think would contribute to reducing cost. I was talking about the community health centers. One of the things that we implemented when I was in the city was, I think, an opportunity to reduce uncompensated care in our emergency rooms and our hospitals. They contributed to ensure that we would have community health center options for anybody, not just those who were underprivileged or who couldn't afford a policy, but anybody who wanted to utilize those services. That is a tremendous component, and I think an important component to providing access to anybody who needs it, whether they're a child or whether they're an adult. And I think that that's got to be part of the model moving forward. And that has bipartisan support in Congress. It's got bipartisan support here in the state of New Hampshire. And wherever you go in the region of our district, people
Why
view
did
that.
you vote to eliminate the law that's going to double community health centers supporting the federal government?
Because again,
Why did you do it? You don't make any sense to me, Mr. Guinta. You make no sense. I'm not here to, all right, I'm a little involved in this. So I just think it would be helpful if you talked about federal policy, because you are our representative to the federal government, not the mayor of Manchester.
Well, I'm using the experience that I've had as running the state's largest city in trying to implement and utilize what we learned from that.
It's financed with federal money from the Medicaid reimbursement, so you're just totally obfuscating the whole thing, in my opinion.
Okay, well,
but I appreciate your willingness to engage.
I respect your opinion.
Please answer that.
I think that I don't believe that this bill is the best manner in which we can reduce costs nationwide. We have a disagreement. I respect the fact that you have a different approach. That's what, makes, I think, our state and our nation great. We get to have this conversation in a respectful, responsible way. But the one thing that I'm not going to do, because I don't believe it, is support this piece of legislation. I do think you've got